Welcome to the Healthy Lifestyle Podcast, brought to you by Telehealth FX, your source for online GLP-1 weight loss and testosterone replacement therapy services. Visit telehealthfx.com to get medically guided access to weight loss peptides like semaglutide and tirzepatide delivered right to your home. That's telehealthfx.com. Now, here's your hosts.
Okay, I want to start today with the moment that stops almost everybody. You've done your research, you've decided a medical weight loss program might actually be the answer. You're ready. And then you Google the price of the medication and you see a number north of $1,000 a month.
And you close the laptop. That's the moment. Research on weight loss programs shows that cost is the number one reason people walk away right before getting started. Not doubt about whether it works, not fear of side effects, price confusion.
And I say confusion on purpose because that's really what it is. Because here's the thing we're unpacking today. That $1,000 plus number is real, but it is not what most people actually end up paying. The pricing in this space is genuinely all over the map, and today we're going to make sense of it.
Exactly. So in this episode of the Healthy Lifestyle Podcast, we're answering the question everybody types into Google eventually. How much does medical weight loss actually cost? We'll break down brand name medication prices versus program prices, what insurance does and doesn't cover, the sneaky costs nobody mentions, and maybe most importantly, the cost of doing nothing, because that number is bigger than people think.
And our usual reminder up front, this is educational content, not medical or financial advice. Prices change, insurance plans differ wildly, and any decision about medication or a weight loss program belongs in a conversation with a licensed healthcare provider.
All right, let's start with the scary number, because we might as well face it head on. If you walk into a pharmacy in the United States with a prescription for a brand name GLP-1 medication and no insurance coverage, what are you looking at?
You're looking at list prices in the range of roughly $1,000 to $1,300 a month, and for some medications, even higher. Wegovy, the brand name semaglutide approved for weight loss, has been listing around $1,300 or more per month. Zepbound, the tirzepatide option, sits in a similar neighborhood at retail.
Which is somewhere between a car payment and a mortgage payment every single month.
Right. And if that were the whole story, medical weight loss really would be out of reach for most families. But that list price is a bit like the sticker price on a hotel room door. Almost nobody actually pays it. There are manufacturer savings programs, pharmacy discount cards, insurance coverage, and telehealth programs that all bring that number way down.
Let's take those one at a time. Start with insurance, because that's everyone's first question.
So insurance coverage for weight loss medication is expanding, but it is not universal, and this is where people get frustrated. Many commercial insurance plans do cover GLP-1s for weight management now, but they typically require something called prior authorization. In plain English, that means your provider has to submit paperwork proving you meet the criteria before the insurance company agrees to pay.
And the criteria usually track the clinical guidelines we talked about in our last episode. A body mass index of 30 or higher, or 27 and up with a weight-related condition, like high blood pressure, prediabetes, or sleep apnea.
Exactly. And here's a detail that surprises people. Many insurers also require documented proof that you've tried lifestyle changes first, sometimes 6 months of documented effort before they'll approve the medication, which is one of those quiet arguments for being in an actual medical program, because your provider is creating that documentation at every visit. The person going it alone has no paper trail.
That's such an underrated point. Your check-ins aren't just support, they're evidence.
And a quick note for anyone on Medicare or Medicaid, coverage there has historically been much more limited for weight loss specifically, though it's been shifting, especially when there's a related condition like diabetes or heart disease involved. It genuinely changes year to year, so that's a check with your plan situation.
Okay, so that's insurance. Now, the path that's grown the fastest, telehealth programs, because this is where the pricing story gets a lot friendlier.
This is the big shift of the last few years. Telehealth-based medical weight loss programs typically charge a monthly fee that bundles things together: the provider visits, the ongoing check-ins, the prescription management, sometimes the medication itself, depending on the program. And industry-wide, those programs generally land somewhere between about $100 and $400 a month, depending on the medication involved and what's included.
So instead of $1,300 a month, a realistic number for many people is in the low to mid-hundreds.
For many people, yes, and the range depends on real variables: which medication your provider determines is right for you, whether your insurance kicks in for the medication portion, how much support is bundled in, but the order of magnitude difference is real, and it's why medically supervised weight loss went from a luxury to something ordinary households are budgeting for.
Let's do the myth-busting segment, because cost myths are everywhere in this space. Myth number 1,
If it doesn't cost $1,000 a month, it must be sketchy.
Not true, but I understand the instinct, and honestly, a little skepticism is healthy here. Legitimate programs achieve lower prices through bundling, through insurance navigation, and through manufacturer savings channels. What you're paying for in a quality program is licensed medical care plus medication access, not just a vial in the mail. The sketchiness test isn't the price. It's whether there's a real medical evaluation, a licensed provider you can actually talk to, and transparent billing.
Myth number 2, the opposite one. The cheapest option is always...
Today's episode is brought to you by Telehealth FX, your source for online GLP-1 weight loss and testosterone replacement therapy services. Visit telehealthfx.com to get medically guided access to weight loss peptides like semaglutide and tirzepatide delivered right to your home. That's telehealthfx.com. Now back to the show.
It's the best deal.
Also no, and here's where I'll put on my consumer protection hat. If a website advertises a rock bottom price, read what's actually included. Some advertise a low first month teaser price that jumps later. Some charge separately for the visit, the medication, and the follow-ups, so the real monthly total is double the headline. And some skip the medical supervision almost entirely, which isn't a discount, it's a downgrade. A 2-minute quiz with no provider conversation is not medical care.
Myth number 3, medical weight loss is more expensive than just dieting on my own.
This is the one I want everyone to sit with, because I think it's the most financially wrong belief in this entire space. Let's actually add up what do-it-yourself weight loss costs. The average person who struggles with weight has spent years cycling through paid diet apps, meal delivery services, supplement stacks, gym memberships they stopped using, and commercial diet programs. Industry surveys consistently find people spending hundreds to thousands of dollars per year on weight loss attempts that, statistically, don't last. We talked about this last episode. The research shows most self-directed dieters regain the weight.
So the DIY route isn't free. It's a subscription you've been paying for years with a product that doesn't work.
That's the reframe. And then there's the bigger ledger, the health costs of not addressing weight when it's affecting your health. Excess weight is linked to higher spending on blood pressure medication, diabetes care, joint problems, sleep apnea equipment, and more medical visits across the board. Studies on medical spending consistently show adults with obesity spend thousands of dollars per year on healthcare than adults without. Nobody puts that number next to the price program, but it belongs in the comparison.
And remember the flip side from the research. Losing even 5% of body weight measurably improves blood pressure, blood sugar, and cholesterol. Those improvements can literally show up as fewer prescriptions and fewer copays down the road.
Which is why framing this as spending money on weight loss is slightly off. For a lot of people, it's redirecting money they're already spending from things that don't work towards something with strong clinical evidence behind it.
Okay, practical segment. Someone's listening, they're budgeting, they want to do this smart. Walk them through the questions to ask before they commit to any program.
Love it. Question 1. What exactly is included in the monthly price? Provider visits, follow-ups, the medication itself, lab work? Get the all-in number, not the headline number. Question 2. What happens to the price after the first month? Teaser pricing is common, so ask directly. Question 3. Do you help with insurance and prior authorization? A good program navigates that paperwork for you, and if your insurance covers the medication, your out-of-pocket can drop dramatically. Question 4. Can I use my HSA or FSA? Many medical weight loss programs qualify for health savings account dollars, which are pre-tax, and that's an instant discount most people forget they have. And question 5. Is there a contract, or can I adjust month to month as my needs change?
Those 5 questions will save people real money and real frustration.
And this is a natural moment to mention the folks who help make this show possible, because transparency on exactly these questions is why we're comfortable partnering with them. Telehealth FX offers medically guided weight loss with licensed providers, a real medical evaluation, and ongoing support, all from home with clear pricing so you know what you're paying for before you start. If you've been stuck at the how much does this cost stage, go to telehealthfx.com, see the options, and get your actual questions answered.
Because that's really the answer to today's question, isn't it? How much does medical weight loss cost is a question with a range, not a number. And the only way to get your number is a real evaluation with a real provider.
Exactly. Your insurance, your health profile, and which medication is clinically right for you are the 3 things that determine your actual price. And no article or podcast can know those for you. What we can tell you is the realistic landscape. Roughly $100 to $400 a month for most telehealth programs, potentially less with insurance coverage, versus $1,000 only if you pay full retail with zero help, which almost nobody should be doing.
Let's cover common money mistakes before we wrap. What do people get wrong even after they've decided to move forward?
Mistake 1, choosing purely on price and ending up with no real medical support, then quitting in month 2 because nobody helped them manage early side effects. The cheapest program you quit is the most expensive one you'll ever buy. Mistake 2, not calling their insurance first. A 10-minute phone call asking whether your plan covers weight management medication and what documentation it requires can change your entire budget. Mistake 3, forgetting the HSA and FSA option we mentioned. And mistake 4, treating the program fee as the only investment. Budget a little for the things that protect your results. Decent protein at the grocery store, maybe some basic resistance bands or dumbbells. Those are the cheapest parts of the whole journey, and they're the ones that make it last.
And the nuance we always honor on this show, everyone's financial situation is different, just like everyone's body is different. For some people, the numbers work today. For others, the right move is starting with structured lifestyle changes while they sort out insurance or savings. There's no shame in either path, and a good provider will meet you where you are.
If this episode cleared things up for you, share it with somebody who saw that $1,000 headline and gave up. They deserve the full picture.
And tell us in the comments what surprised you most about the real costs. Did your insurance come through or fight you on it? Your stories help everyone in this community make smarter decisions.
All right, 3 key takeaways. Number 1, the scary list price isn't the real price. Brand name medications can list over $1,000 a month, but between insurance, savings programs, and bundled telehealth care, most people pay a fraction of that, commonly in the $100 to $400 range.
Number 2, do-it-yourself isn't free. Years of diet programs, apps, and supplements add up to real money spent on approaches that statistically don't last, and untreated weight-related health issues carry their own growing costs. Put the full comparison on paper before you decide anything is too expensive.
Number 3, price shopping is health shopping. The right questions are what's included, what does month 2 cost, do you help with insurance, can I use HSA or FSA dollars, and is there real medical supervision? Transparent answers are the mark of a program worth your money.
And your one action step for this week? Make one phone call to your insurance company. Ask 2 questions. Does my plan cover weight management medication? And what documentation do I need for approval? 10 minutes and you'll know more about your real cost than an hour of Googling could ever tell you.
One call, total clarity. And remember, this episode is educational content, not medical or financial advice. Talk with a licensed healthcare provider before starting any weight loss program or medication.
If you found this valuable, subscribe so you catch every episode. And come back next week for more practical, science-backed wellness on the Healthy Lifestyle Podcast.
Take care of yourselves. See you next time.
Thanks for listening. Be sure to visit our sponsor, Telehealth FX, your source for online GLP-1 weight loss and testosterone replacement therapy services. Go to telehealthfx.com to get medically guided access to weight loss peptides like semaglutide and tirzepatide delivered right to your home. That's telehealthfx.com. See you next time.